Are you one of the many women out there that have been diagnosed with PCOS, you can't lose weight, and you're wondering if Metformin is the answer for you? Hi guys, this is Dr. Don here, and I want to talk to you guys about how Metformin can possibly help you to lose weight. First, let's discuss a little bit what PCOS is. So PCOS, polycystic ovarian syndrome, is caused when women become androgen dominant or testosterone dominant, and therefore elicit a group of symptoms. These symptoms include things like cysts, obviously being developed inside of the ovaries, which in many times leads to the inability to ovulate and causes infertility. And because of the effects of this testosterone dominance, these females are dealing with things like acne, a lot more facial and body hair. The uterine line becomes thick, and so a lot of times because of that, you'll have, cycle symptoms. You'll have PMS symptoms. You'll have heavy flow or painful cycles, or in a lot of cases, you just don't have a cycle at all. But again, all of these symptoms are caused by a female becoming testosterone dominant or androgen dominant. And so how can Metformin help you lose weight? Well, with many women that have PCOS, the main driver of that condition is insulin resistance. Or even type 2 diabetes, right? So what is insulin resistance? What does that mean? Well, insulin is a hormone that is released by the pancreas, and when glucose levels increase in the body, your pancreas will release insulin, which is the hormone that will get the sugar out of your blood and into your cells, where the mitochondria inside your cells now uses that glucose to make energy, right? ATP, which is the cellular energy. And so insulin's job, one of insulin's job, is to get that sugar out of the blood. Now, with insulin resistance, for many different reasons, the body is becoming desensitized to that insulin. So it's starting to resist that insulin and not allowing it to do the proper work. And so with that, the insulin floats around in your blood. Now, the other job of insulin, if you look it up in a medical dictionary, it will tell you that insulin is a fat storing hormone. And so if you're developing insulin resistance, that means you're not able to get the sugar out of your blood and into the cells efficiently. Your body knows the more sugar that's elevated in the blood, the more damage that will occur systemically to the entire body. And so what your body will do in response to that is it will convert that sugar into fat in order to get it out of the bloodstream. And that is one of insulin's jobs. And so with many women, especially the ones that the number one driving cause of the PCOS is insulin resistance, obesity, and diabetes, by taking Metformin, what Metformin does is it increases the sensitivity to that insulin. Therefore, the insulin in your body is now getting the sugar back into cells instead of converting that sugar into fat. And so obviously, the less fat you make consistently, the easier it is to lose weight. Now, what exactly is Metformin doing? Is this a good long-term approach, or is there's side effects? Is there negative things that can be occurring all because of taking Metformin? And the answer to that is, well, yes, Metformin does numerous different things in the body. See, Metformin is the most popular diabetic drug in the entire world because it is very, very effective in helping diabetics, along with diet and exercise, to help maintain a better sugar level inside their blood. Now, how exactly is Metformin accomplishing that? And so again, number one, and the reason why it will help those of you that have PCOS, especially in the earlier stages, it will help you because what it does is it sensitizes your body to that insulin. So the insulin's able to be more effective in not making fat, but in getting the sugar out of your blood. Now, what it does is mainly has an effect on your muscle tissue. So it increases the sensitivity of your muscle tissue. So now you're driving that sugar into your muscles. Another thing that it does is it doesn't allow your body go through a process called gluconeogenesis, which is just a fancy term of explaining that your liver will drop sugar into your bloodstream, especially in the nighttime hours or the fasting hours. And so a lot of diabetics, or a lot of you guys that are dealing with insulin resistance, your highest sugar is first thing in the morning, also known as the dawn effect. Right? And the reason being is because your adrenal glands communicate with your liver, and when the sugars start to drop because you're not consuming any food, your liver will then secrete sugar into the body, and now you have more sugar to stabilize you throughout the nighttime hours. Well, again, in many cases with insulin resistance, you have a lot of sugar being dumped, but your body can't get it into the cells where it belongs. And so again, you're making fat while you're sleeping. Very, very frustrating for a lot of women out there, and men as well, but especially women that are dealing with PCOS. And so listen, I understand we want a quick fix. If I can just take a medication to help me lose weight, listen, I'm on board. As long as it's not going to kill me, as long as there's not any major side effects, then I'm on board. And that's what a lot of women are doing. Because again, if insulin resistance is the main reason why you've developed PCOS, then not only can it help you lose weight, but it can temporarily improve the symptoms of acne and excess hair growth, and the absence of cycles or painful cycles, whatever it is that your symptoms are. But again, what's the long-term effects? And that's what I've always wanted my patients to look at when it comes to any kind of treatment. See, I'm going to shoot another video here on my channel that's going to talk about supplements and herbs that can help with the symptoms of PCOS. And see, depending on what is driving your PCOS, my approach would be completely different. Unfortunately, they don't dive in. When I say they, the conventional approach, their testing doesn't dive into truly finding out why you have PCOS. And so across the board, they will recommend or prescribe metformin regardless of the cause, because in most cases, you're going to see improvement in symptoms. But the question I like to ask, is it truly fixing the problem? Because if you took metformin for 2 years, you lost some weight, some symptoms improved, maybe you were able to get pregnant, maybe you started to have a cycle again, the acne started to improve, maybe these things happen, but what happens when you stop taking the metformin? And see, in many cases, in most all cases, those symptoms are going to slowly come back, because the metformin is truly not fixing the insulin resistance. Again, if it did, you'd be able to take it for a period of time, get off of it, and the insulin resistance would be corrected. But the fact of the matter is, metformin, like any kind of pharmaceutical, kind of manipulates physiology in order to make symptoms go away. With a diabetic, because it's the most commonly used drug, because it's very effective. But what we see over time is your body becomes accustomed to what's going on. So it kind of adapts to those chemicals that are inside of metformin. And so over time, we just see the doses need to be increased. Now, one of the other things that it does is it kind of manipulates how your body absorbs sugar or carbohydrates in the GI tract. And so, initially people can have some GI symptoms, whether it's nausea, diarrhea, just a lot of uncomfortable feelings in the stomach. But again, when you start to manipulate physiology of how you're digesting and absorbing foods, the long-term effects can be very devastating to your gut health. Now, gut health is very, very important for everybody, but when it comes to inflammation, when it comes to any kind of condition or disease process, the one thing we all agree on, when I say we all, it doesn't matter what kind of doctor you are, whether you're a medical practitioner, a chiropractor, a naturopath, a homeopath, the one thing we all agree on is that inflammation drives all disease. And so with PCOS, we have a lot of inflammatory processes that are occurring. And so if we can truly get down to what's causing those inflammatory processes, truly get down to what's causing your body to be androgen and testosterone dominant, and truly fix those underlying causes, then we don't need to stay on drugs like metformin. We don't need to stay on a bunch of herbs in order for the symptoms to go away. See, I've been helping people with their health for almost a decade now. And, in my early years, I like to say that I was a traditional functional medicine doctor, graduated from chiropractic college in 2011. I did postgraduate studies for 3 years through Functional Medicine University in Florida, where I got my diplomate in functional medicine. And that's where I was trained, yes, on how to dive deeper into labs, learn more about endocrinology and physiology, biochemistry, these type of things. But most functional medicine doctors are trained to use an herb to suppress a symptom instead of to use a drug to suppress a symptom. And so what I found myself doing is putting people on a lot of different herbs for their symptoms. And don't get me wrong, I mean, there was a lot less side effects versus taking medications. The patients felt a lot better and their symptoms were dramatically improved. But what happens if they stop taking all these herbs, right? And the answer is the symptoms started to come back. So that told me that I truly wasn't fixing the cause of the problem. And so what I've done over the past several years is truly, got these treatment protocols. And it really started with the type of testing I do, but not just the testing, but how I address these dysfunctions is to truly dive below the surface of the symptoms. And when you dive below the surface and you can truly start to see what's causing these hormone imbalances, and if you understand the hormone pathways, then there's ways to correct those pathways. See, my job, regardless of what symptoms, conditions, or disease processes you come to me with, my job is to normalize function in your body. See, if your body's functioning the way it was designed to function, then there's no presence of hormone imbalances. Yes, you have a lot of different symptoms with this condition, but they're all caused by a testosterone dominance and the androgen dominance in your body. So what is causing those hormone imbalances? And again, more times than not, it is insulin resistance, and it is diabetes and obesity. And that statement right there was a lot more truth to it 5, 7, 10 years ago than it is today. See, there's so many different things that will negatively impact females' hormones. Stress is the number one thing that affects females' hormones. Not very often are your physicians testing your stress levels, your cortisol levels, your DHEA levels, your adrenal gland function, right? And more today, because of the amount of stress that women deal with, stress is becoming more of a negative impact than the actual obesity and insulin resistance. And so for this reason, less and less are we seeing metformin being effective in helping women lose weight. And taking that another step, we're seeing metformin for those that it is effective with, it's only lasting a short period of time. And then without changing lifestyle, without changing diets, the weight starts to creep back up. So you go back to your doc, hey, it worked great for a little while, and then again, they're going to increase the amount of metformin that you're taking. Now, we need to understand too that metformin is a diabetic drug, and so more times than not, it can actually make the insulin resistance worse long-term. Okay, long-term. And so guys, we got to really look at the medication. We got to look at our ultimate goals. If your only goal is to lose weight, I will tell you that you're going to be chasing your tail for years when it comes to overall health, because being overweight is a symptom, just like the hormone imbalance, the acne, the cycle issues, the anxiety, the depression, the cravings, all of these things you're dealing with are symptoms, but so is weight loss. See, over the years, I've been able to help people find the secret to help them lose weight when all they did was want to lose weight. But I always tell women, especially women, the best way to lose weight and keep it off, right, is to get healthy. And that takes time. But the good thing about PCOS is that hormone imbalances can be corrected pretty quickly with the correct approach, okay? So guys, listen, metformin can be effective in helping you lose weight. But again, there's only one way it's effective is when insulin resistance is the driving cause of your PCOS. But the problem is metformin doesn't correct the insulin resistance. It just temporarily, while you're on the medication, will suppress your insulin levels, increase sensitivity to the insulin. Therefore, you're making less fat. So obviously, you're going to start to lose weight a little easier, okay? But if you're the one that truly wants to fix the cause, truly wants to know why you have PCOS, maybe even just do some in-depth testing to find out what exactly your hormone levels are doing. I'd be happy to help you guys with that. That's been my passion over the years. Infertility hits close to home for me. I've got, a brother-in-law and a sister we just helped get pregnant that was told, you just may not be designed to have a kid, is what she was told, and it crushed her. And her hormone imbalances, PCOS and types of things that she was dealing with is why she couldn't get pregnant. And so by getting her healthy, getting her hormones balanced out, putting her on an anti-inflammatory diet, telling her how to exercise during different phases of her cycle, She was able to get pregnant, right? And we see this happen with people all the time. And so listen, like this video, share this video around, guys. There's so many women out there that are being told that there's not much you can do about it. You're gonna have to live with it. Maybe take some medications to make the symptoms go away. But at the end of the day, there's no cure. I'm here to tell you that's not true. Don't let anybody ever tell you anything about your health process. Because see, when they tell you that, oh, it's genetics or there's no cure, well, that takes your power away. See, I'm here to empower you. I'm here to tell you that our bodies can heal. And if we can figure out what your stressors are, what your triggers are, what's driving these inflammatory responses and these hormone imbalances, and we can correct those down beneath the surface of the symptoms, we can absolutely reverse this process. If you can't get pregnant, there's a good chance you correct your hormones, you get these testosterone levels normalized, normalize your estrogens and your progesterone. There's a good chance we can get you pregnant. All right. So guys, like this, share this, subscribe to my channel. We're going to have a lot of information on here about PCOS, infertility, hormone imbalances, how stress can affect all these things. So I look forward to getting back with you guys soon, and have a great day.